Dr. Chirag Kotecha from Refined Skin and Body Clinic. So you've got melasma or you've got hyperpigmentation from stubborn acne scarring. How do we treat it? First of all, we need to tell you about melasma. Melasma can be caused by multiple conditions. Most commonly that we see here are due to hormonal changes such as multiple pregnancies, you've had many children. 2, you've not taken care of the sun exposure, you've not been applying sunscreen. Genetics, you've got a family history of melasma. 4, you're overtly stressed, which leads to increased cortisol levels, which in turn lead to increased pigmentation. Or you're on some certain medications for other medical problems that can lead to increased sun sensitivity, and pigmentation. So how do we treat it? First of all, it's not a magical cure. It takes a few months. I normally start off my approach with a 3-month program of a monthly chemical peel, and my favorite is the Perfect Derma Peel, which helps exfoliate the skin. We apply this on the face, and for about a week your skin will peel off. After which you will use a good skincare program consisting of either glycolic acids, kojic acids in our mela cream, vitamin C to protect you from the sun again, and very definitely the sunscreen that you need to apply to protect from the sun. So the first